Hi, I am Linda. In this video, I shall explore the best foods to eat and the worst foods to avoid when you have arthritis, which is a chronic disease that attacks your joints. The joints are a complex structure made of two bones with cartilage, ligaments, tendons, and synovial fluid. They all work together for smooth and pain-free movement. However, when you age or injure yourself, you may develop arthritis, with the injured joints developing pain and inflammation, such as conditions like arthritis, also reduced mobility. The role of a diet is to keep your joints healthy. In this video, I will help you to find good foods for unhealthy joints. These are called anti-inflammatory foods. I shall also go through the bad foods that you should not have as it can worsen the symptoms. Inflammation is the main factor of joint damage. Certain foods can worsen inflammation, but some can help. These are called anti-inflammatory foods. They include fresh fruit, vegetables, lean meat and much more. Bone density is another factor of arthritis. Your joints can become thin or fracture easily, and certain foods like calcium and vitamin D can maintain healthy bones. I shall go into the best and worst foods for your unhealthy joints. Support your joints and alleviate the symptoms of joint conditions. But first, I shall explore the understanding of arthritis and joints. There are 100 different types of arthritis, with two main groups, which are osteoarthritis and rheumatoid arthritis. The symptoms can include pain, stiffness, swelling and a decrease in movement. Arthritis is one of the leading causes of disability, and can affect millions of people worldwide. It can develop at any age and background. The first main type of arthritis is osteoarthritis, which is the most common type, that is called wear and tear of the joints. This is because it slowly breaks down the cartilage in the joints. The cartilage is the cushion that is between the joint bones. This can lead to deterioration of the joints. The symptoms of this include pain, especially when you move. You will be able to hear creaking and cracking sounds. Other symptoms include stiffness in the morning or after periods of inactivity, joint tenderness, inflammation, and occasional swelling. The second common type is rheumatoid arthritis, which attacks your immune system. It mistakenly attacks the synovium, which is the lining of the membrane that surrounds the joints. This second one also attacks multiple joints equally. For example, if you have the disease in your right hand, you will develop it in your left hand. The symptoms can include inflammation that can lead to joint damage, pain, swelling, and eventually deformity and loss of function. Other symptoms can be fatigue, fever, weight loss, and joint stiffness, especially in the morning when you have not moved for a while, and unfortunately, it could last for hours. Eating proper foods can help to improve your arthritis by reducing the symptoms of inflammation and pain and supporting joint health. If you are struggling with inflammation of the joints, then you should be eating foods called anti-inflammatory foods. These foods can reduce pain, stiffness, and swelling, as well as inflammation. These foods are rich in antioxidants, vitamins, minerals, and phytochemicals that help with healing and protect the joints against cellular damage. Key nutrients that are beneficial for your joints are the number 1 omega-3 fatty acids. These are oily fish such as salmon, sardines, and mackerel. Omega-3 can also be in chia seeds, flax seeds, and walnuts. The benefits are reduced inflammation in the body and improved joint pain and stiffness, particularly if you have rheumatoid arthritis. Number 2 is fruits and vegetables. The best ones to eat are berries like blueberries, strawberries, raspberries, or cherries, and oranges. The best vegetables are kiwi, spinach, Swiss chard, kale, broccoli, and bell peppers. The benefits of fruit and vegetables are rich in antioxidants, vitamin C and E, and phytochemicals such as flavonoids and carotenoids. These nutrients help reduce inflammation and protect joint tissues from damage. Number 3, whole grains. These are quinoa, brown rice, oats, barley, and whole wheat. The benefit of whole grain is that it is full of carbohydrates that help with continued energy and fiber, leading to digestive health. Fiber also helps your inflammation and supports a healthy gut. Number 4 is nuts and seeds. There are many types of nuts, but the main ones that can reduce inflammation are almonds, walnuts, flax seeds, and chia seeds. The benefits of nuts and seeds are that they are full of omega-3 fatty acids, fiber, and antioxidants, which help to reduce inflammation. Also, nuts can support your heart health and essential nutrients for maintaining your joints. The last one, number 5, is lean proteins. These include skinless poultry such as chicken or turkey, lean cuts of beef or pork, tofu, or legumes, beans, or lentils. The benefits of protein are vital for repairing and maintaining your muscles. They provide good amino acids, without the bad saturated fats, which can contribute to inflammation. Some tips that you can include with anti-inflammatory foods. The first is how to plan a meal. You should plan a balanced meal with a variety of anti-inflammatory foods. Use foods that are colorful: fruits, vegetables, whole grain lean proteins, and healthy fats. Number 2 is how you can snack safely without your inflammation worsening. Instead of reaching out for those lovely donuts or any other sugary snacks, it would be best if you chose nutrient-dense snacks like fresh fruit, raw vegetables with hummus, or a handful of nuts and seeds. These options satisfy hunger and provide essential vitamins and minerals. Number 3 is how to cook without frying in oil or boiling all the nutrients out of the vegetables. The best cooking methods are steaming, baking, grilling, or sautéing with healthy oils like olive oil or avocado oil. Number 4, hydration. You should also stay hydrated with water throughout the day. Or you could drink herbal teas, particularly green tea, as it can provide antioxidants and anti-inflammatory benefits. Now I shall talk about the bad foods that you should avoid if you have inflammation. Whereas inflammatory foods help with reducing your inflammation and helping the symptoms of arthritis, these pro-inflammation foods worsen your symptoms. These will increase your inflammation and joint pain, stiffness, and swelling. So, the foods that you should avoid or minimize include processed foods. These can include fast foods like burgers, fries, and pizzas. Packaged snacks like chips, crackers, cookies, crisps, or cereals and breakfast bars. Processed meats like hot dogs, sausages, deli meats. The negative impact of these types of foods can trigger inflammation, as they are high in unhealthy fats, such as trans fats, saturated fats, and refined sugar. They often contain additives and preservatives that contribute to inflammation. Number 2 is refined sugars. These sugars cause spikes in your blood glucose levels and can lead to increased inflammation. A high intake of sugar can also contribute to your weight gain, therefore putting pressure on your weight-bearing joints, such as your hips and knees. Refined sugars can include sweets like candy, cakes, buns, and cookies. Sugary drinks include soda, sweetened teas or coffee, and energy drinks. Alternatively, if you have a sweet tooth, you can instead have natural sweet foods like fruit and berries. Or when you need sugar in your drinks, you should go for natural sweeteners including maple syrup, honey, or stevia, but in moderation. Saturated and trans fats are bad fats that cause rapid spikes in your blood sugar level. These include, for example, red meat, like beef, pork or lamb, and full-fat dairy items. Number 3, refined carbohydrates. These include white bread, white rice, pastries, and baked goods made with white flour. Refined carbohydrates are high in glycemic index that can also cause rapid spikes in blood sugar and insulin levels. These spikes can lead to increased inflammation and therefore worsen arthritis symptoms. They can also have very little nutritional value compared to whole grains and can contribute to weight gain. Number 4 is alcohol. You should not have excessive amounts of alcohol like beer, wine, spirits, and cocktails. Alcohol can lead to high levels of inflammation. It can also interfere with your medication and reduce its effect. Alcohol can contribute to weight gain and increased uric acid levels, which can trigger gout attacks. Number 5 is certain additives that include monosodium glutamate, aspartame, and certain food colorings and preservatives. Additives can trigger the response of inflammation if you are sensitive. You can find these additives in processed and packaged foods, which are generally unhealthy. They can also worsen symptoms if you are sensitive or allergic to foods. In addition to changing your diet, various lifestyle changes can significantly impact your arthritis symptoms. Implementing a full approach such as doing regular exercises, stress management, weight control, and good sleep hygiene can improve joint health and your quality of life. I shall now go into how you can change your lifestyle so that you can live a better life. The first one is the benefits of doing regular exercise. Regular exercise is essential for your joints as it helps to improve your mobility, keeping your joints flexible and the range of motion. Exercising can also help with strengthening your muscles. Keeping your muscles strong is important as it supports and protects the joints, reduces the pain and stiffness that you may have, and helps with your cardiovascular health, weight management, and mental well-being. The exercises that are recommended are gentle low impact, including walking, swimming, and cycling. These are gentle on the joints while providing cardiovascular benefits. Strength training. This is using weights, resistance bands, or bodyweight exercises to strengthen muscles around the joints. Another exercise is flexibility exercises. These include stretching routines, such as yoga and Pilates, which help improve joint flexibility and reduce stiffness. The last type of exercise that can help your symptoms could be balance and coordination. With my osteoarthritis, my balance is deteriorating, so I need to do Tai Chi and specific balance exercises that may help with stability and prevent falls. Some exercise tips. When you start exercising, it is important to start slowly, with low-impact exercises, and increase the intensity and duration. You should also warm up and cool down. Proper warm-up and cool-down routines help prevent injury and reduce muscle soreness. You should also listen to your body, pay attention to the pain signals and avoid overexertion. Modify or stop exercises that cause discomfort. Number 2 is the impact of stress when you have arthritis. The symptom of inflammation can cause chronic stress that leads to an increase of the inflammatory chemicals in the body to worsen. Stress can also cause muscle tension, which can aggravate joint pain and stiffness. Another stress can be disruption in your sleep pattern, interfering with your sleep, and poor sleep quality can increase arthritis symptoms. You can reduce this stress by doing some techniques, such as meditation. When you meditate, you can help reduce stress and promote relaxation. Another technique is deep breathing techniques, can help calm the mind and reduce physical tension. You could also start a hobby or interest. As you engage in an activity that you enjoy, you can provide a mental break from stresses and improve overall mood. Lastly, it is good if you join social support. This can reduce isolation and stress. When you go to support groups or talk to friends and family, they also help with emotional support. Number 3 is weight management. If you are overweight or obese, you are putting stress on your already unhealthy joints, such as your weight-bearing joints, including your knees, hips, and spine, worsening arthritis symptoms. You may also increase your inflammation through your body fat, called adipose tissue, producing inflammatory chemicals that can contribute to systemic inflammation. If you have a healthy weight, you can improve mobility and reduce the risk of joint damage. Number 4, sleep hygiene. Poor sleep quality is associated with increased inflammation and higher pain levels. Lack of sleep can lower the pain threshold and increase sensitivity to pain. Acceptable sleep is crucial for physical and mental health, including your immune function and mood regulation. While diet and lifestyle changes are crucial for managing your arthritis symptoms, supplements and alternative therapies can also help to reduce the pain and inflammation. Understanding which supplements are beneficial and exploring various alternative therapies can provide additional help for improving your joint health and overall well-being. The best supplements for your arthritis include omega-3 fatty acids. You can find this in fish oil, flaxseed oil, chia seeds, and walnuts. The benefits of omega-3 are the powerful anti-inflammatory properties that can help reduce joint pain and stiffness, particularly in rheumatoid arthritis. Number 2 is glucosamine and chondroitin. You will be able to find these in shellfish. The benefits are the compounds that are naturally found in cartilage and may help slow cartilage degradation, reduce pain, and improve joint function, particularly in osteoarthritis. Number 3 is herbs. The best ones are turmeric curcumin, which is found in turmeric root. Curcumin supplements have strong anti-inflammatory and antioxidant effects, which can help reduce joint inflammation and pain. Number 4, vitamin D. You can get vitamin D from the rays of the sunshine. The benefits of this vitamin are crucial for bone health and may help reduce the risk of arthritis-related complications. Number 5 is Boswellia serrata or frankincense. They get the extract from the Boswellia tree resin, which is full of anti-inflammatory properties, and can help reduce pain and improve function in osteoarthritis and rheumatoid arthritis. Number 6 methylsulfonylmethane. The benefits of this may help reduce pain and inflammation and improve joint function. Number 7 is antioxidants that you can find in vitamin C and E. You will get these in fruits, vegetables, nuts, seeds, and supplements. The benefit of antioxidants is that it helps protect your cells from oxidative damage, which can contribute to inflammation and joint damage in arthritis. There are also alternative therapies that you can try, such as number 1, you could go to acupuncture, which is a traditional Chinese medicine practice that involves inserting thin needles into specific points on the body. The benefits of this are it helps to reduce pain and improve joint function by stimulating the body's natural pain-relieving inflammation. But you must find a licensed and experienced acupuncturist. The results can differ, and many sessions could be needed. I have tried this, but it got too expensive. Number 2 is physical therapy, which helps to keep your joints working. It uses exercises, manual techniques, and sensory systems to improve movement and function. The benefits of physical therapy are to strengthen your muscles, improve the mobility in your joints, and reduce pain. Again, you should work with a licensed physical therapist who has experience treating arthritis patients. They will also give you a personalized exercise plan. Number 3 is massage therapy. As in the first 2 techniques, you should see a licensed person. A massage therapist will massage your body to your needs. Massage therapy manipulates the muscles and soft tissues to reduce the tension and pain you have. The benefits of massaging can alleviate muscle tension, improve circulation, and reduce joint pain and stiffness. Another one is chiropractic. A professional focuses on manipulating the spine. The benefits may help to improve joint function, reduce pain, and help with your mobility. Number 5 is mind-body techniques, which involve yoga and tai chi. These practices combine physical movement, meditation, and breathing exercises. The benefits can improve flexibility, balance, and strength, reduce stress, and enhance mental clarity. Number 6 is hydrotherapy. This is done using warm water for relieving pain. The warm water can help relax your muscles, reduce joint stiffness, and help pain. But you should consult with a healthcare provider before you start doing hydrotherapy. And number 7 is aromatherapy, which is using essential oils from plants for therapeutic purposes. Essential oils can be beneficial to you, such as lavender, eucalyptus, and peppermint. They can help reduce pain and promote relaxation. But be extra careful if you want to do this one. Use essential oils safely by diluting them with carrier oils and avoiding direct application to the skin. Inhalation or diffusing is another effective method. This is very important. Professional guidance. Always consult with a healthcare provider before starting any new supplement or alternative therapy. This is crucial to avoid medication interactions and ensure the chosen therapies are appropriate for your condition. Your healthcare provider can offer personalized advice based on your specific type of arthritis, overall health, and treatment goals. When selecting supplements, opt for high-quality products from reputable brands that have been tested for purity and potency. Be cautious of products containing contaminants or fillers that could exacerbate symptoms. Managing arthritis requires a complex approach that includes diet, lifestyle changes, supplements, and alternative therapies. Arthritis is a broad term encompassing various conditions, mainly joint pain and inflammation. Changing your diet to anti-inflammatory foods such as fatty fish, leafy greens, nuts, seeds, and whole grains can help reduce inflammation and alleviate arthritis symptoms. But be aware that certain foods can worsen your symptoms. They include processed foods, sugary snacks, refined carbohydrates, and red meat. Limiting or avoiding these foods can help manage inflammation and pain. Also, regular exercise, stress management, weight control, and good sleep hygiene are crucial to reducing the symptoms. Thank you for listening to my video. I am not a medical professional, and this video is for information only. If you are worried about anything, you should always consult your healthcare professional. Do not forget to subscribe to my channel and click on the bell to receive notifications when new videos are released. I hope this video has helped, and good luck.